I watched the documentary Growing Up Poor, which targeted poverty in Australia, and it really challenged my opinion of young children, especially who live in poorer suburbs, in regards to truancy. So, yeah, this documentary really opened my eyes to the different social determinants of health that are at play in a child's life. So things like education, family dynamics, unemployment, geographical location, social exclusion, etc., etc., etc. That the children actually don't have control over, and it really does impact their health and well-being. So I've only ever worked in childcare, and I don't really see myself straying from this field when I graduate. So what I learnt from this documentary and what I'm planning on taking forward with me is that there's so much more to a child's story than what we see. There's a child who's behaving badly, but why are they behaving that way? And, there's a child skipping school, but why are they skipping school? And, there's two stories that really stuck out to me from the documentary. Jessica, who lost her school bag, lost her books, and didn't want to go to school. She didn't want to get in trouble for it. It's like, well, yeah, fair enough. Like, if you're going to get in trouble for not having your stuff, fair enough you don't want to go to school, And Jada, who doesn't do her homework, not because she doesn't want to do her homework, but because she doesn't have the stuff to do her homework. Like, she doesn't have pencils to be able to do her homework. So there's so much more than just what's happening. There is so much behind it. So then with cultural humility, Australia, we're a very, very diverse country. We're all really aware of that. And for healthcare professionals, it's really important to understand the different cultures so that everybody that they see gets the best possible care. So I read a concept analysis by Ferronda in 2016, and they found that there are some key aspects of cultural humility, like the ability to self-question and critique, bidirectional cultural immersion, active listening, and flexible negotiation. So these things are really important in being able to eliminate this power imbalance that you quite often see between a healthcare professional and their patient. But one thing that I learnt from this paper that I didn't think that I'd learn, but yeah, I thought I'd learn something else, but I didn't, is that for me personally, culture to me quite often means ethnicity. And what this paper discussed was that it's actually a lot more than that, which now thinking about it, it's like, yeah, it is a lot more than that. There's, sexual orientation, there's social status, there's interprofessional relationships, and it's all really important for me to take forward because that's something I wasn't completely aware of that can prove to be quite damaging if I don't take it into account as I go. And then with emotional intelligence, it's okay to have emotions and it's okay to react to situations. And, through a TED talk that I watched, it's really important to connect with your own emotions and have that conversation with yourself so that your brain can digest it and you can move forward and take the steps you need to take to move past it and learn from it. And it's also important to connect with other people's emotions, the people that you work with, as well as the patients and clients that you see, to see how they're responding to things as well and adapt where you need to. And I know it's going to be really important going forward because I'm a very passionate person and I know that there are moments that are going to absolutely break my heart and there are going to be moments that make me so frustrated, but I need to understand that it's not always appropriate to have those reactions in front of a team member or in front of a patient. So knowing that there is a time and a place and to wait for that moment to have my response and then move forward from it so that so that I can grow from it and learn before I see the next person I need to see. We initially wanted to create some small businesses in rural Cambodia to prevent families who are living in poverty from selling their children into the sex industry. And for the businesses, we decided to go with the textiles industry because through research we found that it's really quite popular and really thriving in Southeast Asia. But what I've now realised with a little bit of self-reflection is that we haven't really taken into account what they want to do, like what their passions are, and whether or not they'll actually want to do it, because we've kind of assumed that everybody that we want to get involved is going to want to do it, which isn't necessarily the case. So if I were to lead the project from the start, I think I would have had a bit of a closer look at Cotter's 8 steps of change, in particular the engaging and empowering the community by asking them, we want to, just saying to them, we want to help you guys, we want to start some small businesses. What businesses do you want to do? And that's, reaching back to a client-centered approach, which is kind of what occupational therapy is and why it's unique. And also creating a sense of urgency. So educating them on what it actually is that they're selling their children into, because quite often they'll sell to people who say, oh yeah, they can come into the city and they can work in a cafe, but it's not the case. Just educating them on what's actually happening and how it's really damaging for the child, educating them that there are a wealth of opportunities that we want to try and help create, so that they don't have to be put in that situation where they have to sell their child to be able to make ends meet. In the past, obviously at uni we do group work a lot, group projects, and I have worked with some people in the past who aren't really passionate about the project and have a lack of drive and a lack of accountability, and it's really hard to I think delegate elements of a task or a project to people who you can't really trust, because there's been elements that have been completed poorly, and moments where we've gotten a mark back which doesn't really reflect everybody's contribution. So for me personally, if I get a bad mark, I want it to be because I've done poorly, or if I get a good mark, it's a reflection of my efforts. So I don't like delegating to others because I don't like not knowing what the quality of the work's going to be. And that's something that obviously I'm going to have to improve on. So that's the first leadership skill I think I need to improve on is delegation. And the way to develop that skill, I believe, is through just going back to like emotional intelligence and connecting with others emotionally and understanding what makes them tick and what drives them and what skills they have, so that tasks can be delegated to people who are skilled for them and who are passionate about the different elements of the project, just so that you can have that trust with somebody and that ability to just let parts of it go and to give creative freedom to people who know what they're doing and who are passionate about it. The other leadership skill that I need to work on would be feedback, both giving and receiving. So I'm not very good at receiving feedback because I quite often take it personally, even if it's not intended to be that way, and that's just because I don't like being told that something that I've worked really hard on is wrong. But it's obviously really important to receive feedback so that you can be corrected to create the best possible outcome for whatever it is that you're receiving feedback for. And it's not that you've screwed up, it's just that someone with a fresh pair of eyes can have a look and say, this is working really well, but I think that you could perhaps do it another way, or whatever the case may be. And similarly with giving feedback, quite often I don't want to give feedback because I don't want to hurt people's feelings. And again, if it's constructive feedback and it's worded correctly, it'll be about the situation or the element of the project or whatever the case may be, not the actual person. So and it's really important for a leader, someone in a leadership position, to give feedback to people who they're leading, so that the project or whatever's happening, it gets done to the best possible standard, and that everybody is pulling their weight and doing things correctly.